Good morning. Today we'll be seeing about endocrine gland, which is in related with your apical part of the kidney, that is supra renal gland. What is the other name of this gland? This is adrenal gland. So this we'll be seeing under following headings. What is where it is located, that is location, and its features. Then we'll be seeing it what are the what are the capsules related with this. Then we'll be seeing the relations of this. Then interior part of it, and at last arterial, venous, lymphatic, and nerve supply of this. So where do you get the suprarenal gland? Suprarenal gland is related with the apical part, or you can say upper part of the kidney. Both they are located both on the right and the left side, or on either side of the vertebral column. So if you see specifically in relation with parts of the abdomen, location is they are present in the epigastric region, related on either side of the vertebral column. If this is the right kidney and the left kidney, above this we have a paired glands, that is suprarenal gland. So these are right and left suprarenal gland, which are in relation with the right and left kidney. So coming to its features, what are the features you can see here? What is the length of it? What is the width of it? What is the thickness? And what is its weight? So length of it is around 50 mm, width is around 30 mm, thickness is around 10 mm, and the weight is around 5 grams. So this is a paired endocrine gland, which is related on either side closer to the vertebral column, on either side related with the upper part of the kidney, and it's a retroperitoneal organ which is in close relation with the posterior abdominal wall. Then in this we have capsules. What are these capsules? If you see a section of a kidney, if this is the kidney, above that we have the suprarenal gland. So covering this kidney and the suprarenal gland, there are, so we'll be seeing only the specific with this suprarenal gland. So surrounding the suprarenal gland there are two types of coverings, that is the capsule. So what are they? One is true capsule, other one is false capsule. So true capsule is this dotted one, which is derived from the fibrous stroma, which is modification of the fibrous stroma, that is the true capsule, whereas the false capsule is nothing but it's derived from the renal fascia. So this renal fascia, first in it will be enclosing the kidney, then after it's enclosing the kidney, it's again splitting up and enclosing this suprarenal gland. So that is the false capsule, which is nothing but modification of the renal fascia. So that is the capsules. What are the true capsule and false capsule? True capsule is nothing but modification of the fibrous stroma, and true capsule is nothing but modification of the renal fascia. So what happens to this renal fascia? False capsule upwards, this anterior and the posterior layer of the false capsule, they go upwards and attach to the diaphragm. So this false capsule, which is going upwards and attaching to the diaphragm, that we are calling it as suspensory ligament of the suprarenal gland. So suspensory ligament is nothing but the false capsule which is fusing in the apical part, and then it's going and attaching to the diaphragm. Then coming to this in detail, so here we are having two glands, that is on the right side and on the left side. So right suprarenal gland and the left suprarenal gland. So how are they? What is this shape? Right suprarenal gland is something pyramidal, whereas the left suprarenal gland is something like a crescent shape, half moon shape. So these are related with the apical part of the right and the left kidneys. So here you are seeing this is the right, this is the left suprarenal gland. Looking at that, so here we will be seeing this side. Right suprarenal gland, how is the shape? It is pyramidal in shape. What about the left one? This is crescent shaped. Then apart from this, this is having presenting features like it has an apex, it is having a base which is related with the kidney, two borders. This is the medial border and this is the lateral border, and apart from that it has two surfaces, that is the what we are seeing now, that is the anterior surface, and other one is the posterior surface. So these are the presenting features of the right kidney. It's having an apex and a base, so it's looking like something like a pyramid. So apical part, basal part, medial border, lateral border, anterior surface, and behind we have posterior. So then coming to this left suprarenal gland, it is crescentic shape, so it's having two ends. This is the lower end and this will be the upper end, and it's having two borders, medial border and lateral border. What are the two borders? Same thing, this is medial border and this is the lateral border. So it's having the same thing, two surfaces. What are they? Anterior surface and the posterior surface. First we'll be seeing this right kidney, then we'll be going on to the left side. So right kidney is having an apex and a base. Closer to this apex we have a hilum. So in this, passing through the hilum, we have this right suprarenal vein which is coming out of this right suprarenal gland. So toward near the apical part we have this hilum. Passing through the hilum we are having the right suprarenal vein. Then coming to the surfaces, anterior surface and the posterior surface. Anterior surface is having, it's divided again by a ridge. This ridge, in few texts they say it as the anterior border. So that ridge will be dividing this anterior surface into two things. So this is the medial part and this is the lateral part. So this dotted one we are calling it as the anteromedial surface, or you can say just anteromedial. This will be anterolateral. So related with this anteromedial part of the, suprarenal gland, that is the right suprarenal gland, will be there is vein. What is that? Is inferior vena cava. Then anterolateral part. Suppose what lies on the right side of your body, that is the liver. So anterolateral part, it's related with two things. Anterolateral part is related with the liver, anteromedial part is related with the inferior vena cava. Then coming to the posterior part, posterior surface, how it looks, something like this. If you're turning towards the back. So posterior surface is divided into two things, upper part and the lower. So upper is somewhat convex and the lower one is concave. So this upper part of your posterior surface is related with the diaphragm. So this surface, this diaphragm will be separating this suprarenal gland from the costodiaphragmatic recess, that separates this suprarenal gland from the right lungs. So this is upper part is related with the diaphragm and the lower part is, which is concave, is related with the upper part of your right kidney. So that is our right suprarenal gland. So what are they? Right suprarenal gland is having apex, base, medial border, lateral border, anterior surface and the posterior surface. So apex, near the, closer to the apex, there is hilum through which right suprarenal vein is coming out of this suprarenal gland. Anterior surface, there is a ridge that is also called the anterior border, that divides that into anteromedial part and anterolateral part. Anteromedial part is related with the inferior vena cava and anterolateral part is related with the liver. Then posterior surface, here you have two things, upper and the lower part. So upper part of the posterior surface is convex and the lower part of the posterior surface is concave. So upper part is related with the diaphragm. This diaphragm will be separating it from the costodiaphragmatic recess of the right lung. Then inferiorly, it's related with the right kidney. Then coming to the left suprarenal gland. So how is the shape of the left suprarenal gland? This is crescent shape. It's having a upper part, upper end, two borders, medial border, lateral border, two surfaces, anterior and the posterior surface. So if you see this, this is the left kidney. If you are seeing from the anterior way, so it's two ends. This is the lower end, this is the upper end, two borders. This will be lateral border, this will be medial border, and it's having a anterior surface and the posterior. So if they turn it the other side, how it looks, if you see this from the back. So this anterior surface of the left suprarenal gland you can divide that into upper region and the lower region. So upper region of this anterior surface is related with the stomach. Separating this from the stomach, we have this omental bursa or the lesser sac. So if you see the omental bursa, posteriorly we have this left kidney, left suprarenal gland. So this is what it is. So upper part of the anterior surface of the left suprarenal gland is related with the stomach. Separating that, in between the stomach and the suprarenal gland, we are having omental bursa or the lesser sac. Then the lower region of this anterior surface is related with pancreas, and going along the upper border of the pancreas we have a splenic artery. So these are the relations of the anterior surface of the left suprarenal gland. So this left suprarenal gland, if you see the same thing in the posterior view, it will be, you can divide that into its medial relations and the lateral relation, how it is related medially and laterally. Medial part of the posterior surface of the left suprarenal gland is related with left crus of the diaphragm, and the lateral part is related with the left kidney, anterior surface of the upper part of the left kidney. So that is the left suprarenal gland, which is having upper end, lower end, medial border, lateral border, anterior surface having related with the stomach above, inferiorly it's related with pancreas and splenic artery and all. Then in the lower end it's having hilum. Through the hilum we have this left suprarenal vein which is coming out and draining it to left kidney. Then coming to the interior of this suprarenal gland, so interiorly it's related with, interiorly you are having three things in the cortex and one thing in the middle. So interior of this suprarenal gland, it's having cortex, which is outer part, which is approximately 9 out of 10th part, and you have medulla, which is 1/10 of the entire suprarenal gland. So this cortex is again divided into three zones: zona glomerulosa, next thing is zona fasciculata, and zona reticularis. This cortex is developed from mesoderm, whereas this medulla is a derivative of neural crest cells. So zona glomerulosa is concerned with secretion of mineralocorticoids. One of that is aldosterone. So if there is a decrease in the secretion of that, we have a disease called Addison's disease. So this is applied aspect for this zona glomerulosa. Zona fasciculata is concerned with secretion of glucocorticoids. One example is cortisol. If there is excess secretion of this glucocorticoids, we have Cushing's syndrome. Then what about this reticularis? It's concerned with secretion of some six hormones. One of them is estrogen, and one more thing is androgens. So this are concerned with the secondary sexual characters. Then medulla, this is a derivative from neural crest cells. It's having chromaffin cells, which will be having connections with your sympathetic nerves. So these are called chromaffin cells because of their staining. So these will be secreting catecholamines, that is adrenaline and noradrenaline. So these are the fight and flight hormones. So there is a tumor of this chromaffin cells, that is pheochromocytoma. So that is the applied aspect for this different zones of this suprarenal gland, that is outer cortex, which is a derivative of mesoderm. It's divided into three zones: zona glomerulosa, zona fasciculata, and reticularis. Zona glomerulosa is concerned with secretion of mineralocorticoids. So if there is a decreased secretion of mineralocorticoids, that is Addison's disease. Basically, these mineralocorticoids are concerned with the sodium and potassium balance. This glucocorticoids is concerned with the carbohydrate and protein metabolisms. This sex hormones are concerned with the secondary sexual characters. Then medulla is developed from neural crest cells. So there you have chromaffin cells, which will be secreting the flight and fight hormones. That is the interior of this suprarenal gland. Next thing is the arterial supply, venous drainage, lymphatics, and the nerve supply. So for that we'll just draw a diagram of this. This is the right kidney, this is the left kidney. Above that we are having our right suprarenal gland, which is somewhat pyramidal shape, left suprarenal gland, which is crescentic shape. So related with this right suprarenal gland is related with inferior vena cava, in between we have this abdominal aorta. So before that, in the relations of this two both suprarenal glands, right and left side, along the medial borders of both right and left suprarenal glands, we'll be having celiac ganglions, and apart from that they are related with inferior phrenic arteries. So these are the relations along the medial border of the both right and left suprarenal glands. Then coming to this arterial supply, so this abdominal aorta will be coming down after piercing the diaphragm, right? So as soon as it is piercing the diaphragm, below that there is an artery, that is inferior phrenic artery. So from that there is a branch going to this suprarenal gland. Then one more branch directly coming from the abdominal aorta. Then lower down, these are the renal arteries. So from this there are pair of arteries going to this suprarenal gland. So based on their position you are naming them as superior middle and inferior suprarenal arteries. So superior suprarenal artery is a branch of inferior phrenic artery. Middle suprarenal artery is a direct branch of the aorta. Inferior suprarenal artery is a branch of the renal artery. Then coming to this, so these suprarenal arteries, after they pierce the capsule, they form a plexus and they give different abundant branches, and these will be forming the plexus. Then coming to the venous drainage, as we have seen before, this right suprarenal gland is having a hilum closer to the apex. From that we have a vein, that is the right suprarenal vein, which directly drains into the inferior vena cava. Then this is the left renal vein, so draining into that. So where is the hilum of the left suprarenal gland? It is in the lower end. So this is the left suprarenal vein, which is a tributary of the left renal vein. So that is the venous drainage of this suprarenal gland. Then we have one more thing. On either side of the aorta there are some lymphatics. These are the para aortic nodes. So the lymphatics from this suprarenal glands are going into this para aortic nodes. Then coming to the nerve supply, these are having sympathetic fibers coming from T8 to L1. These form a plexus. Then they enter into the cortex and medulla, and predominantly they go to the medulla and they form synapses with the chromaffin cells, and in turn that will be regulating the secretion of the hormones. And apart from that, additional to this nerve supply, you have one more thing concerned with the function of this adrenal glands, that is adrenocorticotropic hormone, ACTH. So that is about the arterial supply. Arterial supply, venous drainage and lymphatics. Arterial supply, superior is a branch of the inferior phrenic artery, middle is a branch of the aorta, inferior is a branch of the renal one. Right suprarenal vein is directly draining into the inferior vena cava, whereas the left suprarenal vein is draining into left renal vein. Coming to the features, right one is a pyramidal one, left one is crescentic, right one is having apex, base, medial border, lateral border, anterior surface, medially it's related with the kidney, medially it's related with the inferior vena cava, and laterally it's related with the liver. This posteriorly this will be related with the diaphragm and kidney, whereas this left suprarenal gland is having a lower end and upper end, and in this anteriorly it's related with the stomach and omental basa, inferiorly it's related with the pancreas and the splenic artery, posteriorly it's related with the left crest of diaphragm and the kidney. Both right and left kidney, medially they are related with the celiac ganglions and inferior phrenic artery. Then this suprarenal gland is having outer cortex and inner medulla. Cortex is derived from the mesoderm and the medulla is derived from the neural crest cells. The cortex is related with the secretion of glucocorticoids, mineralocorticoids and some sick hormones, and this medulla is related with the secretion of the catecholamines, that is adrenaline and noradrenaline. That is the flight and the fight hormone. Thank you.